Measles is a viral illness. It's very contagious. It's probably one of the most contagious illnesses that exist on the planet. If there is a patient with measles who enters a room, anyone who enters that room for 2 hours after that patient has left the room can still contract measles. We have not had measles outbreaks until recently because the vaccination rate was so high. And once we're above a certain threshold of vaccination in the country, which is about 95% vaccination rate, then we usually don't see cases. When the vaccination rates fall below 95%, and they are at about 93% right now, then we start seeing these cases. Other than vaccinating your family, there is not much else you can do to prevent measles, other than avoid travel to areas where there are outbreaks or where it is endemic. The immunization has been so successful and is so immunogenic that honestly, after one vaccine, 93% chance of never catching measles. After 2 vaccines, 97% effective. You won't miss the measles. That patient will be ill appearing. Once you've had 3 to 4 days of the runny nose and cough and red eyes and fever, then the rash begins, and it begins on your head along your hairline. Highest risk of complications from measles will fall, unfortunately, into those that are the youngest. Those below 5 years of age tend to have the most complications, along with pregnant women. The fatality rate associated with measles infection in the population under 5 years of age is about 1 to 3 fatalities or deaths for every 1,000 cases of measles. The only time that vitamin A is indicated is not to prevent measles, it's to treat measles infection when determined it is appropriate in 2 doses by a physician. We do know that measles can cause encephalitis, and the encephalitis can cause cognitive delays and problems in anyone who gets measles. So if you are concerned about your child's developmental process, then the MMR vaccine will be the way to go. The next steps would be, if it is an unvaccinated patient, you need to vaccinate that patient with a measles, mumps, and rubella vaccine immediately within 72 hours. If it's been past 3 days and there has been definite exposure, then you want to discuss the use of immunoglobulin within the first 6 days of exposure. Anyone 6 months and up can receive the MMR vaccine. The regular dosing schedule would begin at 12 to 15 months of age for the first dose of MMR, and the second dose should be given between 4 and 6 years of age. Now, anyone born before the year 1957 is considered to have had measles infection at some point. Birth before 1957 is assumed to be immune due to infection.